sure that everybody kind of gets trained up pretty good and kind of knows what's going on, especially when it comes to health insurance and Medicare. So today we're going to kind of just go over a little bit of the basics back in Medicare and kind of start back to the beginning again, because some of you all in this room have not gone through an AEP yet, which is our annual enrollment period. But a lot of my handouts I'm going to give to you today are things that you're going to have in your books that you can kind of laminate or put into protective holders, so when you're out in the field and you run across some plants, you'll know exactly what those benefits are. I spent a lot of time making cheat sheets to show you exactly what Medicare plans and how they stack up next to each other. That way it makes it very easy. I'll go ahead and do my disclaimer now. On the bottom of each of these sheets, these are the important ones that do not go through CMS. It says on here, only be used internally for Cornerstone Wealth agents, not to be shown out to the public. And that's very important. This is information for you guys to make sure you can do your job intelligently and be able to look at one plan next to another one and know exactly what the benefits are. It's kind of the easy way of getting around doing things. But it's need to make sure that if you ever get somebody from CMS, see the shopper comes up and says, why are you showing that to a client? It's not intended to show for clients. So please keep that to yourself. I put a disclaimer on here every year because it's a CYA. So because somebody comes back to me, I say, I told him, it's on tape. So that's why I'm being recorded.
Roll it back.
This is only for your use only, but people have found them very, very useful in the past. They have been doing these for about 5 or 6 years, and it does make it very helpful when you run it to a client's home. So the first thing I'm going to give out today, and a couple of these books that I'm handing out to you, these are great books to have for clients. They're called Medicare Made Clear books. You can order these if you're licensed with United Healthcare. You can get these for free. They don't cost any money at all.
Where?
UnitedHealthProducers.com, which is United Healthcare. There's an agent toolkit. You can order any of these materials for free.
I just want to say this, man. How y'all doing?
Everybody say hi, Mike.
Hey,
Mike. These are great booklets. The main reason I like these is in the very beginning, it talks about Medicare. It talks about who is eligible for Medicare. Anybody that turns 65 or anybody that's on disability for 24 months is eligible for Medicare. The biggest part is right here. This is my favorite page. Anybody that's turning 65, I almost always bring this book and I sit down with them and I'll leave it with them. Because you can order 100, 200, 300 of these books. So you have plenty of these where you can take out with you. But it is very nice because somebody that's very new to Medicare may not know all the issues of Medicare, what's all involved. And there's two main choices when you come on Medicare. One of them, and a lot of you have heard me talk during my Medicare trainings, either when you were new or when, like Greg, your team came on originally with us, and we went over your choices of Medicare. Once you have Medicare A and B, you have a choice of looking at, hey Oscar, come on in. Bring me lunch? Oh, good. But it shows you your two choices. One choice is going to original Medicare and looking at Medicare supplement and a Part D plan, or the other choice is Medicare Advantage. And it shows you right here nice and plain. A lot of people like to show them this black and white. It makes it easy for them to understand and see. And you can tell them that there's the two options. Now I want to kind of explain to you what's the difference between the two options. And that's really when you come down to, Medicare supplement is a private insurance offered by companies other than original Medicare that helps pick up the extra deductibles and co-insurance from Medicare. And that's your Medicare supplement. And then of course your Part C, which is your Medicare Advantage, which is a lot of what we're going to talk about today, because this time of year is the enrollment period that everybody that has a Medicare Advantage plan can look at other Medicare Advantage plans and compare and find the best plan for them. And so this is a really busy part for Medicare Advantage. But it's nice to see that right on one page so they can understand what the differences are. And then there's some other things in the book that people may have questions about, but it's a nice book to be able to leave behind. I think you can always also have those customized too. Where did my markers go?
You can have the books customized?
Pretty sure you can have them customized too. They have like your name on there.
Okay.
Most of the stuff through the agent toolkit is great. I order things all the time. Most of it does not cost anything at all. Every once in a while you run into something that you order 100 or 200 and they cost you like 10 or 20 bucks. But most of them have no cost to them at all. So the agent toolkit is a great place to go. So again, you might as well, if you're going to sit down with somebody, You want to look a little more professional. You want to be able to leave a book behind with them and explain to them about Medicare Advantage or about Medicare supplements. It's a great way to do it. So that's the reason I kind of start off with that Medicare Made Clear book. But if anybody has any questions about that, it's a great way to start. Well, now when you get to Medicare, then you start getting into, I'm not going to write down these are going to be your Medicare guidelines. Because some of you may have our new Medicare guidelines. Anybody have these? No?
I got
Okay.
mine training.
Okay, you got yours in training?
Yeah.
I know some of you did, you don't have one. But this essentially is all the different guidelines of Medicare. You have one, don't ask me. You want one just in case?
Did I bring my hand?
I don't know what you read.
I think I was asking. No, you can
I think you already have them, but just in case. So this is something that we update every single year. We don't have the 2017 guidelines yet. I read some articles yesterday with what they think it's going to happen, but they haven't published them yet. So I don't like to give them out until they publish them. Usually sometime right about middle of October, they'll come out and publish it right when you're ready to get out selling. But the biggest thing is, most people that want to know is a couple different things. Number one, what is my Medicare Part B going to cost me? So they want to know right now, they're trying to raise that Medicare Part B premium. Most people right now pay $104.90. Your Medicare Part B premium is for your doctor's care. As you all should know, you have two parts of Medicare. You have Medicare Part A, which is your hospital coverage, and your Part B, which is your doctor's coverage. Your Part B is the part that you pay for. Your Part A is what you worked for and paid into your Medicare while you're working. You paid in your Medicare for, I think it's 30 quarters, and then your Part A is free.
40.
Well, no, 40 is Part B.
Yes.
Part A first, and then if not, your 30 quarters is your Part A. You can pay a premium. There's actually a pretty high premium for Part A.
Yeah.
You could pay up to $400 a month for Part A if you did not work enough quarters. So it's pretty expensive. But most people that get Medicare already worked enough, so they get a Part A. Your Part B is what has the premium on it. Right now, most people on the Part B premium is $104.90. If anybody turns 65 in 2016, well, it's $121.40. So that's for anybody that's new to Medicare this year. So anybody just turned 65, anybody just started Medicare this year, they're paying the $121 premium. Don't be surprised if everyone goes up to that for next year. There is going to be an increase. We got held off last year because they didn't give a Social Security increase. If they give a Social Security increase, it's going to be a Medicare Part B increase.
Another question.
Yeah.
Well, you got 121.80, you got 121.40.
Ah, 121.80, you're right.
I want to make sure we're talking about the right.
Thanks for keeping me honest, Leonard. Maybe I was building my sheets too. Since I create them. You think I know them all by heart, but they change every year, so just when you start to get it down again, then they switch it again, yeah. So, when you're talking about your Medicare, you've got two main issues. You got the deductible for your Part A, not your hospital deductible. So if you went into the hospital, right now your deductible is $1,288. That's your deductible for days 1 through 60 in a hospital. So if you went in the hospital for 1 day, you went in the hospital for 10 days, you went in the hospital for 60 days, it's the same price, it's $1,288. That's your Medicare deductible. If you're going longer than that, it's a per day charge. I'm not going to go through all them, it's listed there. It's $322 a day from 61 through 90, $644 a day from 90 through 150. And again, most people are there longer than 60 or 80 days, you got a major problem anyway. So, but that's your biggest thing is your $1,288 deductible. There is a Part B deductible. This year it's $166. Actually, I don't write too much on that board because it's such a great handwriting. That's why I type everything. Yes, that's why I'll be showing you today, towards the end of our training, how to be able to enroll in Medicare Advantage electronically, because it makes it nice and easier. And guess what? You don't have any problems with turning things in. Yes, so your Medicare Part B is $166 deductible. Now, this deductible here is non-annual deductible. The $106 Part B, that is an annual deductible. Why I mention that? It's very important. A lot of people think, well, that $1,288 is annual deductible. But if you went to the hospital in January, you're covered for 60 days. So make it easy. Going for January 1st, you can be covered for all January, all February, and the first couple of days of March to get to 60 days. Once you get past 60 days, say April, you go back in the hospital again. You owe that $1,288 again. Because it's not an annual deductible. It's a per time deductible, per 60-day deductible.
For 60 days?
Per 60 days. Your visit covers 60 days. So if you go to the hospital, you go to the hospital in January, you come back out January 10th, and January 20th, which is my birthday, I went back to the hospital on my birthday, January 20th, you go back in, you're still under that 60 days.
Okay.
So you don't owe that $1,288 then. But if you go back in May, you're owing it again. So a lot of people don't realize that you can pay that up to 5 times. If you do your math, your 60-day period, you can pay it up to 5 times. Which is a lot of money at that point. No.
It's just really
Yeah,
bad.
the 60 days is a weird thing, but yeah. It's a bad thing. If you're in the hospital that much, that's
Yeah.
other issues. And by then, you better have a Medicare supplement.
If you're not in the hospital like by day 58, you're gonna make yourself go. You're gonna hit yourself with something.
You're gonna do something there. So, the other thing is under your Part A is your skilled nursing. Skilled nursing is essentially rehab. So when you look at it, you can have skilled nursing done at home, skilled nursing done in a facility, skilled nursing done in a hospital. There's a lot of different things you can have skilled nursing, but it's very important because your skilled nursing, it follows Medicare rules. So if you go in the hospital, one of the first thing is you must stay 3 days in the hospital. So in order for Medicare to cover your skilled nursing, you got to stay in the hospital 3 days. Easy enough. You have 30 days to start the rehab once you get out. It's not usually a problem because if you have had a knee replacement or hip or something, you're probably going to want to rehab that because it's probably not going to get better and then you're going to be a problem. And then you must be showing continued improvement. So you've got to be getting better. Those 3 things are covered, then Medicare will pay for the first 20 days. And then all the Medicare plans we're going to go over today, you'll see there's a $0 copayment for the first 20 days. After that, you've got a per day charge on there again. Right now it's $152 a day for days 21 to 100. That is original Medicare in a nutshell. It is expensive to be on original Medicare. It doesn't cover things such as there's nothing, no extras, no prescription, other things that are out there that are Medicare Advantage plans that are going to help pick up. They don't cover this. So original Medicare itself is there, but honestly, Medicare would love for you to be in some other type of plan because then they're not playing insurance company. Medicare is a federal program. It's not an insurance company, and so that's why they have these little things that just keep going up. The Part A deductible and Part B deductible change every single year and go up higher. The premium keeps going up, and it's going to be that way. Anybody have any problems with Medicare? Medicare, most people know Medicare, so I don't want to focus too much on that one. There's 2 different things that people always ask for, and this is our new Medicare, Medicaid program limits. This is a nice sheet that you can have if somebody you think qualify for one of the programs, like an extra health program or a Medicaid.
So there's not going to be a change in 2017?
Well, there probably will be.
Yeah, probably will be, but it hasn't been adjusted yet. This is 2016.
Okay.
Yeah, if you look at the top, it says 2016. We don't have the 17 changes yet.
Okay.
As soon as I get them, I will obviously update and get back out to everyone.
Quick question, real quick, Scott. On the Part B premiums on the income part, do they just take your last tax return? Like when you turn 65, and they say, all right, this is what it's going to be. Do they change that every year? Obviously, you retire and you're taking less income.
Yes, obviously there are some rules with that. They're going to look at your income, like you said. You see they're making $85,000 or more, you pay more. So yes, they're going to look at your last tax return. Everything now is pretty much done through the government, through your IRS. They can see exactly kind of what you're making. They also have some rules on how it can affect when it comes to not just that premium, but also where you get, what you get taxed on, how much money you can make. They have some weird rules where at age 65 when you retire, you can't make as much money as you want to. It's gonna help, your benefit's gonna decrease. But at age 60, I think it's 66 and a half, is it 66 and a half, I think it is, then you can make as much as you want to.
66.
It's 66 or 66, that's a weird number in there, but then you can make as much as you want to. It's really weird. I don't know if they want you to just quit working when you turn 65 and then start working again, but really, the only time you really run into that is like business owners. You run into business owners, or doctors, things like that, but the business owners are smart, probably have a corporation anyway, they like pay themselves other corporations, so it's not that much of an issue. You don't run into it very often. You do it once in a while. Every once in a while somebody's gonna say, why am I not paying 121 and they're paying, one of the other ones, 170, 243, yeah. And that's the reason why I like to have these sheets, because you can show them and say, okay, well, how much money are you making? Oh, you're making about 100,000, that's why you're paying 170. So it's really more reference sheets, that all these are. It's kind of like this one. I don't want a lot of people out there really doing what the government's supposed to be here for and applying for Medicaid and things like that, but I want to give you resources. So if somebody says, I'm making $1,100 a month, what programs could I possibly qualify for? It's a nice little easy cheat sheet that shows you what the Medicaid limits are. And just quickly, just so you know what these are, the easiest one to qualify for is extra help. Extra help is what they also call LAS. I don't like LAS that much because it's low income subsidy. It sounds much better to have extra help than you have no money. But on the extra help, it shows you can make how much you can make, how much a married couple can make, and it shows you also some resource limits. If you look on the right side, there's the resources. So you can see what goes into resources. They even count cash inside of your life insurance. So there are a lot of things that go into resources. But they show you what they can do for your prescription drugs on the side if you have extra help. Again, you go into a little lower income, you can look at your QI or the SLMB program, which is for your Medicare Part B premiums.
How do you sign a person up for those two?
You can actually do those through SSA.gov, which is the Social Security website. Again, I will help some people with it, but a lot of times, especially if they're working with one of the Medicare Advantage companies, they can help them do that too. They have people to do it, but you can go to SSA.gov. It's one of the things you can do electronically online, and it says apply for the extra help program. You can be an assister in that program and help them apply. They're going to ask for you, your name, your address, and then their information. And pretty much all you need is their Medicare information, their Social Security, their income.
Right.
Well, it only takes about, once you start, if you do it a few times, it takes about 10 minutes to do. It's not that bad. Again, I don't do it that often, but sometimes I have somebody that just sitting near a computer, just can't do it, and it speeds it up tremendously. But you can apply for the SLMB program and the extra all in one application. So I don't have to get sent off there, which is kind of nice. And the last one's Medicaid. I rarely ever help somebody with Medicaid because they're a lot more involved in that one. Medicaid, a lot of times I'll try to send them down to somebody that does just Medicaid. But because of some of the programs we work with, people that are on Medicare and Medicaid, you want to be able to help them as much as possible. But a lot of times people just say, I don't know what I can qualify for, and that's how this little sheet here helps you. It shows you what it is that you can qualify for.
Helping them with that is your path to helping them with Plan C.
Sure.
Which is what
And we'll come back to that too when I get the Medicare things out. But you're right, because if somebody is on extra help, not only is it going to, let's say, by the way, if you do get one of the programs, then you qualify for the ones that are below it. So if you get full Medicaid, you automatically get Part B paid for, and you're getting the extra help, which is automatic. If you get the Part B paid for, you're also getting extra help. It doesn't work the other way, but it goes down. So anything that qualifies up here, also you qualify automatically for the ones below it, which is good to know. So if you help somebody get the Part B assistance, you already know they're going to get extra help. And when we talk about enrollment periods, which we're getting ready to do next, the extra help allows them to have a 12-month enrollment period. So that way, if they need to change plans, you help them get an extra help, you can go ahead and enroll them into the new plan, and they have extra help to pay for that.
Okay.
So it really helps this year, so it's going to help tremendously when we talk a little bit about it in a minute on premiums this year. It didn't really on premiums last year, This year it's going to. So it's really going to be a big assistance, and it allows people to do that. If people have Medicaid, they've got a 12-month enrollment period. So you can enroll people anytime. So if somebody's sitting there on just Medicare and a prescription drug plan, and they have Medicaid, you can help enroll them into a Medicaid plan, Medicare, Medicaid plan, which is nice.
So if they have one of these other programs below the Medicaid, are there any special need plans for them as well?
Yeah, and we'll go over the special needs plans here in just a minute. There are a combination of different types of plans. There we go.
You can have it.
All right. This one, very simply, is the enrollment periods. I want you all to understand exactly how the enrollment periods work, exactly what each enrollment period is. I had a conversation with John today because he called it the OEP, which is really the AEP enrollment period, which is the very top one. Where's my marker? No, I want to erase. Right now, everything that we're talking about today, everything that I'm going to hand out to you, you cannot even talk about these plans until after October 1st. October 1st is the first of the marketing period for the AEP, which is AEP is the annual enrollment period. Annual enrollment period. That goes on from October 15th, October 15th to December 7th. Every year. During that time, that's when you see all kinds of commercials on TV. Humana now has their own channel on Dish Network and DirecTV, so you can see them 24 hours a day if you wish. And you'll see AARP, United Healthcare, Mutual of Omaha, they all come out. But during the AEP, which is the annual election period, that allows you to enroll anybody into a Medicare Advantage plan or a prescription drug plan, or make any changes or switches from program to program during that time as many times you want to. So if you help somebody with a Humana plan and they find out, they say, well, you know what, my doctor doesn't take Humana, I need United Healthcare, you go back and help them with that. The last plan that you help them with is the one that's going to start January 1st. Everything that comes in here has an effective date of 1/1/17. So everything that you enroll during this October, November, early December timeframe has an effective date for January 1st.
So somebody that's not on Medicare Advantage now, they can't get it until
Unless they
January the 1st.
Unless they have a special enrollment period, which again we'll talk about here in a second. That's toward the bottom here. Or somebody's turning 65. But the annual enrollment period is the busy one. That's the one that's coming up. The whole reason you guys are here, getting some information on this. So you can go out and talk to people. But you cannot, I can't stress, again, it's on videotape, but you cannot market these plans till October 1st.
Saturday.
Yeah, it's only a couple days from now, so it's not a big deal. You only have a couple of field days till then, but if you go out and you market it and you get secret shops, you're going to be in big trouble. So just go hide for a few days.
I do have a question, because I just spoke with someone today, and they're highly upset because they had Humana. And USC and her doctors no longer.
But we'll talk about the Humana in a minute too, so don't get too far into that. Because we'll bring up the networks and things like that in just a minute. But just tell her, if you get any questions on right now, just say, Mrs. Jones, I don't have all the information right now. I will have it after the weekend, so we can get back together next week. We can figure out a game plan. But you can tell them that you don't get materials, because we just got materials today, but I'm not opening the boxes, because what's open the boxes, people take. I know how that works. We got like 60 boxes in today of Medicare stuff, but you're not allowed to literally market it at all. So I just don't let anybody take it. I just hold them in boxes. John puts them in a room and locks them up till Monday. Well, you laugh at it.
I am.
But do you know how it's working here? All you gotta do is open the box and go,
Are
Small
you
books.
serious?
Fresh paper.
Got a little laugh out of it. I've been doing this 8 years here, and I know how it works.
Oh, so I can get
So yes, that is the biggest, and the AEP is the biggest period. The next period you have coming up, sorry, I put it backwards again, is the MADP. That's the Medicare Advantage disenrollment period. That starts January 1st, which again comes right after the AEP, which you enroll somebody. You also have a disenrollment period. They started this a few years ago because some people said, well, shoot, come January 1st, I'm locked in. What if I accidentally didn't check a doctor or something? Now they're not in my network. I can't change them all year long. So they said, we need a disenrollment period. Disenrollment period has rules. The rules of the disenrollment period is all that you're allowed to do is to disenroll from the plan that you're in and pick up a drug plan. You cannot switch plans. You can't go from one plan to another. You can only disenroll, hence the name for the MADP. You disenroll from the plan that you're in and pick up a drug plan. Now once you do that, you can also pick up a Medicare supplement after that, because Medicare supplement is different. We're going to talk about that in a minute. But you cannot get another Medicare Advantage. So that's why it's the biggest box in here, because it's got different rules in there you got to read. But I just broke it down. What it says in there is that's all it is. You can only disenroll and enroll into a drug plan. And then you get a Medicare supplement. But you're done with Medicare Advantage for the year. Once you hit February 15th, once you hit Valentine's Day, yeah, you're stuck for the whole year, whatever plan you have. Unless you have some type of special period, special enrollment, or we're talking about special needs plans here in a few minutes. After that, you just have regular SCPs. SCPs are things such as extra help, Medicare, Medicaid, losing Medicare and Medicaid, losing extra help, moving from one state to another where your plans change. Somebody, coverage going out of the area, or coverage is discontinued. That's happened a couple times in the last couple of years. We had one a couple of years ago, 2 years ago, Blue Cross Blue Shield pulled out of the state. This year, United Healthcare is pulling some of their LPPOs out of the state. That gives you a little bit of a longer special enrollment period. So there's certain reasons that allow you to get an SEP and get another plan. Those things also allow you, if any of your plans leave the state, it also gives you an SEP for a Medicare supplement. So if there was a time that you were not healthy enough to get a Medicare supplement, or you didn't like the price of one of the supplements that said they'll take you if you're unhealthy, but your plan leaves, you get actually into a Medicare supplement with no questions asked. So there are some people in these LPPO counties that are going to have a few options. Mainly up in Orangeburg County. I don't remember all the counties with the LPPOs, but all the LPPOs are gone as of December 31st for United Healthcare. I think that's the only one that's leaving the state this year. But they're only leaving because they're bringing in HMOs, because we're talking about the minute.
So no matter their age, they can jump into a med sup with guaranteed insurability?
Yeah. If there's something out of the control like that, there's a few other reasons why you can, but that's one of the biggest ones is if your plan leaving, because you have no control of that plan leaving. So that gives you an option. Most people, if they're in that plan anyway, they're not going to change. They're going to change to another Medicare Advantage. Because the reason why they had it was probably because it was like $20 or whatever, and the Medicare supplement's $150, probably not going to jump there. But
Yeah.
some people, you may get somebody you may get somebody that says, oh, you know what, I've had a lot of health problems this last year. I spent a lot of time with doctors. Let me go ahead and get that supplement now, so I don't have to worry about it. Because to be totally honest, you get somebody that is making $1,300, $1,500 a month, I'd rather have them in a Medicare supplement anyway. Because you have them in a Medicare supplement paying $100 or $120 a month, you know that's their outlet for the month.
Yeah.
Yeah,
You don't have
so
to worry about that $1,288.
you don't have to worry about the $45 or $50 specialist visits. You don't have to worry about going to the hospital, having $295 a day copays. When you pay that $120, $130 a month, you're taken care of. So I kind of think that's sometimes it's hard to kind of get that to somebody, but I kind of think if somebody's in that income range, that's actually a better plan for them. But neither here nor there. Then the last one I'll just quickly go through. We spend a lot of time on this normally, but not this time of year. But you have the IEPs or ICEPs. And essentially it means somebody's new to Medicare. Somebody is turning 65, somebody is going on Medicare because they had 24 months of disability. That means somebody's new to Medicare. I'm not going to spend a lot of time on that. That means that they have Part A and Part B, and they have an eligibility date of, I have one coming up, somebody, it's November 1st. They have 7 months to get a plan. 7 months, 3 months before the month they turn 65, and 3 months after. So in this person's case, again, I'm not going to spend a lot of time, but August 1st to, what is that, February 28th, 2017 would be this person's enrollment time. Somebody's turning 65 in November. So that allows you a pretty good period of time to make a choice of what you want to do. So if you want to get a Medicare supplement, you want to get Medicare Advantage, there are no questions asked at all. It's illegal to ask any questions unless you're trying to determine if they should have a special needs plan. Beyond that, you can't ask any questions at all, and they can get whatever plan they want. Now, they only get one choice in that time. So if they choose in August, they're done. If they don't choose again, they don't choose until January. They're done. They get one choice. So you can't choose a Medicare supplement and turn around in January.
Wait until the AEP to make a change.
That's the only time at AEP.
And that can be in the same calendar year.
Can be. I mean, I've had some people turn 65 in the last couple of months and they couldn't decide if they want to supplement or Medicare Advantage. And I said, well, you're kind of lucky. You just turned 65 here in August. In October, you're going to have another period that essentially, if you don't like what you have,
Just want to make sure they don't have to wait a full
they don't.
year.
AEP, you can do it anybody. AEP, you can meet anybody that has Medicare and give them their choices. They have choices at that time.
So just to make sure, they say you did enroll them in August,
Mhm.
and then AEP starts in October.
Mhm.
If they did not like what they chose in August, can they change it? Okay,
Yep.
just confirming.
Yep, during the AEP, you can change with no questions asked. The only thing you cannot change to a no questions asked, you need to be a little bit careful, is a Medicare supplement. Because you still have to qualify. We're going to go over Medicare supplements next, but you still have to qualify for a Medicare supplement. So if somebody has some health issues and they say, well, you know what, I'm thinking about doing a Medicare supplement this year, you probably want to get that in as close to October 15th as you can, or maybe even now, before October 15th. Make sure they qualify, because if not, you still have
Time.
6 weeks to get another Medicare Advantage plan. But you don't want to wait until December 1st, apply for them for a Medicare supplement, you're not going to get a decision by the time December 7th comes.
And that will affect them.
And that does happen. I have a couple people right now have already asked me and said, can we look at a supplement this year? And so you just want to do that ahead of time. Yeah.
Sorry.
Oscar did.
So you're saying that, during open enrollment,
Annual enrollment.
annual enrollment, that it's not best to sign them up in a supplemental plan because they have to qualify? Is that what you're saying?
Medicare supplement plan, unless you have a special reason not getting into a supplement, you do it to qualify. You do have medical questions to get into a Medicare supplement during the year, anytime. So a supplement is a private insurance company
Right,
that do
I
not have to
understand.
take you.
But you're saying during open enrollment, you don't want to enroll them in a
Well, no,
supplemental
you can. You just want to do it ahead, you want to do it early.
early.
Because it may take a couple weeks for them to get approved.
Okay, and if they
If they don't get approved, it
they don't
means-
get approved and it's after October 15th, what happens?
then you put them back in a Medicare Advantage. But they're
Oh,
already-
then you can put them, okay.
Yeah.
I thought they were just stuck with nothing.
No, December 7th is the end. So that's what I said, you don't want to wait till close to December 1st to apply for, because what if it takes 2 weeks and now you pass their eligibility?
Even if they do get approved, they can go back to what they had before
As long as they didn't change
by
it, as long as they didn't change it. Think of it kind of like a life insurance, it's not like life insurance, think of that. You never, when you replace a life insurance, you never want to cancel the other one out until you've replaced it and you've already got it approved and in force.
Yes.
Same situation. You don't want to cancel what they already have. If they have a Care Improvement Plus United Healthcare and you're applying for a Medicare supplement, you're not gonna cancel the other one out until your supplement's approved. And then once your supplement's approved, you go back and get the drug plan to go along with the supplement, which will cancel out the United Healthcare.
Right.
If the supplement gets denied, well, guess what, Mr. Jones, we have to keep you with the United Healthcare another year. But you're not hurting anything.
Is your approval process take a little bit longer during open enrollment period, or?
No, not really, not for supplements.
Okay.
I just don't like people to think it's gonna be,
Tomorrow.
yeah, it's not instant and not guaranteed.
And all those didn't start though until January 1st. right?
Everything, yes.
So every plan.
Yep.
And it's not, it's not, I know from last year, a supplement won't cancel out a supplement when you apply for it.
No,
A
that's.
supplement you will automatically get disenrolled from an MA after you get the drug plan.
After you get the drug plan, that's correct. That's a good thing to mention too. If you're taking somebody from one Medicare supplement, you give them another one because it's a lot more economical, you do have to cancel the old one or have the client. And I try to do it for them. It's peace of mind. I've had a couple of clients in the past, and one actually went off for 3 years, but she said that she was calling to cancel and never did. Never did cancel the supplement, and for 3 years she was paying 2 supplements. Yeah. And I was able to get a good portion of her money back, and then never got all of it back. So don't take your client's word for it. When you help get them a new plan in place, when you deliver that plan, that's when you cancel the old one. And I make the phone call, and if you gotta do something in writing, you do it right there with them and fax it in yourself. Now you've got, again, back to the CYA, you always wanna cover yourself.
This might be a stupid question, but what's the difference between Medicare supplement and Medicare Advantage?
And that's what that first blue book I gave you,
Okay, that would explain.
that's what it explains, yeah, the whole difference in there. We're gonna talk about Medicare Advantage in a minute,
Okay.
and then it'll help you really understand the difference between the two. Let me give Medicare supplements out to you. Hey, this. Most of you already know Medicare supplement charts, but if you don't have one with you, it's always good to have one in your bag. We got an extra one, all right. Because Medicare supplements, every Medicare supplement in this state, for you guys?
Thank you.
You got some chopped liver. Every Medicare supplement state follows the same rules. A through N are all the supplements that are offered in the state. Now, the way Medicare supplements, I saw America, so I'm going to say America. I just pulled America out because it was the first one that I saw. So, but we normally here at Cornerstone normally only sell 3 supplements. We normally only sell the F, the G, and the N. And again, I say we normally, you are open to sell other plans in there, but a lot of times I don't find the value of why you want to sell one other plan besides the F, G, or N. And I rarely sell nothing. Unless somebody comes to me and says, I want Plan F, I rarely sell Plan F. Now, a Medicare supplement is a little different than Medicare Advantage. Medicare supplement, once you have Part A and Part B, then you can get Part D, which is your prescription coverage. So you've got your A, B, you pick up Part D, which is your prescription coverage. And then your Medicare supplement is going to be your Medigap policy. It's going to fill in the blanks. So it's going to pick up essentially what Medicare, the part of Medicare covered but did not pay. So when you're talking about Plan F is the most comprehensive. The reason why I don't like to sell as much as the Plan F is the Plan F also gets the biggest increases from year to year. I'm going to show you in just a few minutes how you can run quotes through our software, where to find it, and where you can compare and see where these how these increases line up. Plan F gets the biggest increases. So unless somebody says I want Plan F, which some people do, they turn 65, and so they heard that their neighbor got, and their aunt got, and their sister got, was Plan F. So in fact, a lot of them say, they got an AARP Plan F, so I want an AARP Plan F. Okay, why do you want an AARP? Well, they have it. Okay. But I'll show them why they may not be exactly right on that, or they may be. but when you show them in black and white, it makes it easy. Plan F is the most comprehensive. Essentially, everything that Medicare, if Medicare covers it, Plan F is going to pay the remainder. So you're talking about your Part A deductibles, your Part B deductibles, your Part B co-insurance at 20%. They're going to cover all that. Plan G is one of my favorites, along with Plan N. I like Plan G, they put it right next to it because besides Plan F, it covers everything except for your Part B deductible. So if you remember, I said the Part B deductible is $166. That's the only thing it does not cover. Normally the difference in cost is about 15 to 20% from a Plan F to a Plan G. You can usually absorb that cost right away, just on the premium. Now if you look at it, I try to look 5 or so years down the line. If you look at the difference in prices 5 or so years, most of the Plan Gs right now, and we'll look at it here on the slides in just a minute, most of the Plan Gs are showing a 0 to 4% increase. A lot of them have gone down to 0, a few of them even decreased in the last couple of years. So your clients will be pretty happy if they get a decrease in their premium. They're not going to be mad at you at all, and then guess what? They're not going anywhere. Now if they had a Plan F and they got a 5% increase, and then a 6% increase, and a 4% increase, and they're all compounding on each other. But your Plan G, you got a 1, -2, a 2. Long term, you're going to keep it a lot longer. Plan N, again, Plan N is a little bit different. Plan N is really for people that were on I think, that 2 different types of people. Number 1, again, it's just my personal opinion, is number 1, somebody is turning 65. Somebody is very healthy, they're coming off of a group plan, they're pretty, they don't care about paying $20 to go to the doctor. Plan N comes out to be a nice little plan for them. Again, they're going to pay the $166 Part B deductible. They're going to pay $20 to get a doctor. It doesn't matter what kind of doctor. It doesn't matter if it's a specialist, urgent care, it's $20. When you go to the hospital, you pay $50, but if you get admitted, you don't pay that $50. So at that point, all they're paying is their $20 co-payments. And a lot of times, it's about a 35 to 40% decrease from Plan F on a Plan N. So a lot of times, somebody's turning 65, you can get a Plan N for about $83 a month. As you'll see, I'll show you in a few minutes here, one of the new Humana plans for the entire state is $80 a month. Okay, $80 a month and they have a $50 specialist co-payment. Pay $80 a month and have a $20 co-payment, and guess what? You go to the hospital, you don't get any big bills. So Medicare Advantage, as you see, is starting to get a little bit more pricey, and as it goes up, I think you'll start seeing Medicare supplements get enrolled a lot more. Which doesn't really hurt my feelings too much, because it's a lot less phone calls that you'll get in Medicare Advantage.
So the N is a better plan for the person who's not going to a regular doctor and a specialist, more than once every couple months. Right?
Medicare's, the Plan N, I think fits a lot of people in there. It really does. The ones that just really don't want the bills, like my mother's a good example. She's on Medicare, she's 68 years old. She would rather pay $200 a month, not get a bill, and not have to worry about it.
She knows what she's paying. And,
Yeah. So Plan N would not be good for that. But
and could save her $100 a month.
Yeah, they just don't want that bill.
and some people are just, it is what, as long as you know what kind of client, but you got to know what kind of plans are out there.
So what did you put your mother in?
She actually already has one through her work.
Okay.
She's with the state retirement system. They actually have Humana up there in Ohio.
Okay.
That's a state retirement system, not like Blue Cross Blue Shield.
But I mean, Dollar, when you're comparing the two, you look at, how often are you going to the doctor? They say once every 6 months, once every 3 months, get my sugar checked, right? Then an N is still the better, because even if you add their co-pays to the premium, it's still much cheaper.
That's the first thing I'll do. First of all, and we'll show just a minute here, what I do is I talk to them about Medicare Supplement versus Medicare Advantage and what's the difference between them. Mm-hmm. And again, I like to have the book there so they can kind of see that. But besides the book, they start talking about it. If somebody says, you know what, I like that Medicare Supplement. I don't want to get the big bills. I don't mind paying $100-something a month. What's best for me? That'll start getting into, okay, how often do you go to the doctor? What kind of doctor are you seeing right now? How often do you go? Do you see a doctor, what, 4 or 5 times a year? 4 or 5 times, you can do it in your head pretty quickly. It's $80, $100 in co-pays. You can do the 166 right there. It's 266. What's the difference going to be from a Plan N to a Plan F? You look at $80 a month versus 140. That's 60. 60 times 12 is 720 bucks. 720 bucks. 720 bucks is quite a bit more than 266.
Right.
And that was just top of my head. So if you start sharpening up paper, that's where it starts to come into play a little bit. Now there is something that on there that some people ask about, so I'll go ahead and get it out there. Besides the Part B deductible, it also talks about Part B excess. Plan N does not pay the Part B excess. I honestly have not run into Part B excess in about 5 years, but it is out there, so you need to know how to explain it. If somebody says, what's the Part B excess? There is a charge, an amount 15% above the Medicare approved amount that a doctor is allowed to charge. So if you go in the hospital, you could have an excess charge. I've seen it before, but I haven't seen it in a long time, because normally, most doctors and hospitals will go ahead and take what Medicare is going to pay. That's normally what they're going to take, and they're going to take what the supplement comes into. But you can have an excess charge.
I'd like to clarify one thing on that excess charge. It's really not an excess charge. It was developed because of non-participating physicians.
Right.
I got a doctor insured. He's head of the cardiology group for 100-some doctors. He's on the Medicare board. He told me he has never seen that. He has never had a claim on that. So it's, and they have to go through a different process. It's a really,
I've seen it once.
really don't need.
I've seen it once on one bill, and I had to call on it because I didn't know, and it's been about five or so years ago.
I've never
Yeah,
seen it.
I've seen it once, but because of that, I just like explain to people, and I'll tell them, look, I've seen it one time, and I've been doing this 8 years in Medicare, and I've seen it one time.
It's probably not worth it to the hospital or the
They have
doctor's
to go
office
through-
because they're reporting requirements.
Yes, and also when they have a claim, it really costs them money to file under that.
You know,
So they, doctors don't. they
that's
don't-
probably why you don't, that's why you don't ever see it.
That's right.
I
It's
never
easier
get,
to take what they'll give us and
right,
leave it at that.
but it's also, the 15% is on the Medicare approved amount, so it's not like, you know, Medicare has a list of what they pay everything. And so if you have a claim of, you know, a hip replacement or whatever, and the doctor says it's $20,000, Medicare may say it's $2,000. And whatever Medicare, that's the Medicare approved amount, so now you look at the excess of the Medicare approved amount, which is a lot less, and the pain of having to file it, now you're looking at not a whole bunch of money. Is it worth $300 to file that? Let me just write that up.
Right.
With 97% of doctors statewide accepting admitted Medicare, it's irrelevant.
Yeah, I have to mention it so you
Yeah.
can explain to the client what that is. Because sometimes, every once in a while, you'll get a client, especially ones that are turning 65, and say, what is that? And so I don't want you to shy away from it. I honestly have seen it once. And the only reason I saw it once is because I didn't know what the heck the charge was, and I had to call up the insurance company to figure out what it was. That's, yeah, yeah, there you go. So, but a lot of times when I'm first talking with somebody that's new to Medicare, how are we doing on time here? We did start late, but we're fine. We're fine. Because the rest of the time is going to be a Medicare Advantage once we finish up the Medicare supplements. And that's the part Barbara's waiting for, right? But what I like to do, it's kind of down and dirty. Again, my handwriting is not very good. So a lot of times if somebody is just coming on new to Medicare, and you may run into, during this time, you may run into a few times. But if somebody is coming into Medicare and I tell them Part A, Part B, I talk about Part D, and then I say, well, the difference is how to treat what's not covered by Medicare and where your deductibles and how that works. I usually tell them there's two different routes. And I never give out really much information on the supplement or advantage plan. I just say, you have Part C, which is actually Part C, considered part of Medicare, your Part C. So what I say is you have two different ways of going. You got a Medicare supplement, and you got a Medicare Advantage, which is Part C. You can write Medicare Advantage so you understand what that is. But Medicare supplement honestly picks up what Medicare does not cover, the 20%, the deductibles, all those different things. I tell people this is as close to 100% coverage as you can get. And again, you never really want to tell somebody it's 100%, so it's as close as you're going to get. And I tell them something corny. I mean, many of you guys took in my training, you've already heard it, but I'll say it again. I tell them it's like a dog. It's like a dog that when you have a good dog, if you drop something on the ground, like my old dog that died a year ago, you drop something on the ground, the dog's gonna pick it up and eat it. And that's what they're there for, they pick all the crumbs up. Medicare does the same thing. If Medicare approves an amount, then on the back end, the Medicare supplement will pick it up. If Medicare does not approve an amount, the Medicare supplement will not pick it up. So it is a Medicare approved amount, the Medicare supplement will pick it up. Depending on if you have got a $20 copayment, or a Plan G where you don't have that copayment, just a deductible, it's going to pick up almost everything. So, it does pick up the deductibles. Deductibles of Part A and B. But it does have a little bit higher premium. You never want to say it's expensive, say it is a little higher premium than a Medicare Advantage. And you do have to have an additional Part D plan. And there's very few, if any, extras.
Very few, if any.
I'd say very few anymore. There's a couple of companies that give some extras. So I used to say there's no extras, but now AARP does have silver sneakers, they have vision discounts, so it's very few extras. Medicare Advantage, on the Part C, on the other hand, they're really known for lower premium. It combines it, A, B, and D together. Most time, all of our Medicare Advantage that we're offering, except for our VA plans, have A, B, and D. The VA plans don't have Part D, because the veterans already have Part D. So it combines everything together. It is a co-payment system. So that means everything that you do has a co-payment associated. If you get blood drawn, you have a co-payment. You go to the doctor, you have a co-payment. You have a specialist, you have a co-payment. You go to the dentist, you have a co-payment. It's a co-payment system. You go in the hospital, it's a co-payment. And most of them have extras. People say, what are the extras? Well, extras such as dental, vision, transportation, depending on your plans. Sometimes health club memberships, well-dine memberships, a lot of different extras that we'll go over here in a minute. So that's really the difference. Usually right there I'll say, which side sounds better to you? I mean, do you like the Medicare supplement better, or do you like the Medicare Advantage better? And then a lot of times we'll say, okay, well, what's the average cost? And that's where your knowledge of writing more than one, you kind of figure out. And you say, well, a lot of times Medicare supplement may run somewhere around $150 a month with the Part D plan, and your Medicare Advantage may run somewhere around $40 a month, but with co-payments. So right then they can say, well, I like the not having any bills, so I like the Medicare supplement. And that's when you go in and start talking about doctors and talk about the different plans. Or they say, you know what, I like the extras. I just came out of the Affordable Care Act. I had co-payments going to the doctor anyway, or I just left my employer, I've had co-payments all my life. I don't mind paying co-payments. So then that's where your Medicare Advantage comes in. But a lot of times I won't even put the cost in there. A lot of times they'll just talk about this, and then they'll say, well, I like this route. Then you can start talking about Medicare supplement companies. But I don't even mention a company until we even get through there. If they say, I like this route, okay, well, then let's look at the companies then.
Should mention max out of pocket very important.
Again, that really is not that.
It is.
You can say that, but I've been doing this 8 years. I have not yet had one person hit max out of pocket.
When I'm 75 years old, I was under Medicare Advantage for 7 years, and personally, and for real, $6,700. You can hit it in a heartbeat.
I have not, honestly, I have about 300 clients that have not hit one. It doesn't say you can't hit it, but the reason.
It's some healthy times.
What? No,
It's some healthy times.
it's not really dumb. But the unhealthy ones, I have a Medicare supplements too, so you gotta kind of look at that. Or maybe they're on Medicaid, you got a lot of different reasons, but we're gonna go over that. That's in this, it's on the sheets. The max out of pocket's on there, because you do want to talk about that. It is important, but we'll get into that here in a second. So that's kind of how I really approach the Medicare supplement versus the Medicare Advantage. Let them kind of choose, hey, I like one route or the other, then you can get into details. But there's no reason you can confuse a client very quickly if you start talking about the company's names and supplements, the company's names and advantage plans, the prices, the extras, and now all of a sudden they've got confused and say, okay, we need another day for this. You're not going to sale anyway. All right, let's go. All right, let's go over the Medicare Advantage plans here real quickly. These are the cheat sheets. This is all of the Humana plans for this year in this area. Unfortunately, Greg, I don't have any upstate stuff in here. But I think your Columbia is in there. The upstate's a whole different animal because they got Aetna and WellCare.
Yeah, we don't do much up there.
You don't do much of that? Okay. Well, in your area, it's mostly Humana, not healthcare, so that's what we're gonna have first. I am not gonna spend a whole bunch of time on this Humana one. I wanted to explain to you kind of how to do this, how to look at it. You can look at the plans, to be totally honest. My feeling at this point is we're not gonna do a whole bunch of Humana plans unless you're in the Charleston area or the Columbia area for the HMO. That's going to be the only plan that's really, really relevant. And part of my reasoning for saying that is once you start going down and looking down the line, the LPPO has now gone up to $67 and the RPPO to $80 a month. If you're paying $80 a month for a Medicare Advantage, I almost rather have you get on the plan N where you're not getting any bills if you can get in there. If not, you'll see that United Healthcare is a lot more competitive on that and on the copay area. Again, didn't really see that until I started putting everything together. They do have the HMOs, which the HMO plans, if you see on there, is $29.19, depending if you're in Charleston or Columbia. The max out of pocket for both those HMOs is $6,700, that is the standard Medicare Advantage max amount of pocket. A few plans have less, but that's the standard one they do. Inpatient hospital is a big one. That's what people are always concerned about. If you had to go in the hospital, that's your going inpatient, $360 a day or $345 a day for days 1 through 5. Once you get past days 5, you don't get charged anymore. So that's where the charge stops. But 5 times 6, you're looking at about $1,700, $1,800. Comes up to be about the same price every year. PCP and specialist, $15 and $50 or $15 and $45, depending on if you're Columbia or Charleston. That didn't change from last year. The skilled nursing did not change from last year. Emergency care did not change. Urgent care did not change. Those all stayed the same. The outpatient surgery did go up. So those of you that sold Humana last year, it is a little bit pricier for the outpatient surgery. Ambulance stayed the same. Home health care. Deductible on drugs did go up. If you look at those HMOs, it's $400 deductible on some of them are tiers 3, 4, and 5. Some are just 4 and 5. Of course, tiers 1 and 2, 90-day supply, you still get a $0 copay from Humana Pharmacy. I'll tell you right now, the dental and vision benefits that are in there, the details, I don't have 100% of the details. I asked them to send me today. My books will be in Thursday. So unfortunately, I had to go by what I could get. I can tell you right now that on that Charleston HMO, there is no vision benefits. The ones that have no vision benefits, that's correct. It's the actual benefit. The one that has the vision benefits is correct. The dental, I'm not sure about. So I do know that they're essentially just doing preventive dental this year. Last year they had a little bit more. They've cut that back. And the vision benefits, some of the plans don't have vision at all. So they definitely cut that back. They also cut back the over-the-counter. You guys remember the over-the-counter last year? They started 2 years ago. They gave a really big over-the-counter benefit, and they cut it back last year. I think it started on the HMO at $40 a month 2 years ago. Went to $15 last year. Now it's cut down to $30 a quarter. So I guess not enough people were doing it in a per month thing, so now they're giving a quarter to do. Get sent in. So it's $30 a quarter on all their plans. Hearing, and then of course silver sneakers. Your Columbia one has wigs for chemo patients. That's a new one.
In acupuncture.
And acupuncture.
We're very aggressive there.
And a couple of them have telemedicine. A couple of the LPPOs have telemedicine, which I like the idea of telemedicine. I have that with my Blue Cross Blue Shield, and I love that.
What is it?
You actually can use a smartphone and call a doctor and see them face to face, and they can prescribe a medication for something simple. So like respiratory or something like that.
I got the flu, okay.
Yeah, yeah, so you don't have to go sit into a doctor's office, because I like the idea. It's only in a couple of plans. That's a new thing coming out.
Sorry, Scott. I mean, how much, for the folks over in Columbia, I mean, how much time do we need to really put into learning this Humana HMO? I mean, compared to the United.
Here's the way I look at it. I never like to not have my products available for my clients. So you will run into where this is good. You're gonna run into, we're talking minute, if you look at the zero premium Humana Medical only RPPO, that's a zero premium, second from the right. That's a nice VA plan. Any of your veterans, there's no reason why they shouldn't have that. So for that reason alone, United Healthcare did come out with one this year, but it's only in the HMO counties. So they'll only be in about 6 counties they're gonna have that. I do like that plan because it doesn't cost anything. It also gives us some of the extras. It also gives them, if they need to get a second choice or second opinion, they have a regular doctor to go to instead of just going back to the VA.
And I think it's only available in Richland County.
What? Do United Healthcare?
No, Humana Health, Humana HMO.
No, it's in the whole state. Oh, I mean, for this one?
Columbia.
Oh, yeah.
2017.
Oh, the HMO, yes.
2017, because I got my Medicare and you book.
No. Yeah, that, I have that.
But the S&P,
Yeah, I'm gonna give you out this little color thing, which shows you all the plans here in a minute.
Okay.
That's all the Humana plans. That's the only thing John let me do in color. He doesn't let me do anything in color. And he doesn't work here, he doesn't like to let you do things in color.
so rule, just
All right, it is only Richland, yes.
Just kind of rule of thumb it, if you're running into a veteran, the Humana S&P might be the preferred plan for them.
The Humana Medical only RPPO is a great little plan. That is a good plan. That's a very good plan. Their HMOs are pretty strong.
Is that the RPPO?
It's the one next to it, the one that says 0.
Yeah.
The RPPO is the one for
Yeah.
veterans, right?
Yeah, that's the veteran right there.
Oh, I got you.
Does not have a premium. The reason it doesn't have a premium because it doesn't have drugs attached to it. There is no Part D benefit. So you cannot sell a Part D benefit with that, it will disenroll them. That's why it's for veterans. Because somebody that's a veteran is usually getting mail order or getting it at the VA. So that's the reason why that plan is there. And again, that plan gives you a lot of those extras, which is great. It also gives you a couple of things of, let's say you go to a VA doctor and they say, you know what, you need knee surgery. And you say, well, you know what, I want somebody else to look at it and really see if I need surgery. Now you can go to a private doctor, he gives a PCP in that plan, and go ahead and pay a $15 copay to go get that looked at. Or if you get admitted to the hospital, if you look in there, it's a $900 admission charge.
So this won't affect any of the benefits they get
Nope.
through the VA?
Nope. Got quite a few people on that plan. They like it a lot. Some people get a little scared of it because they say, how can you do something for nothing?
Right.
But it's a great little plan. Alright, so I'm going to give you the rest of your Humana stuff that you put in your book. This is the one just showing you the footprint,
Yeah,
so you can see what plans are where.
that is.
Again, this is the only pretty color one else allowed. But I tried to do this in black and white, and all you can see are shadows. So you can see.
Does United have a plan like this? The veteran plan?
Yeah, we'll go to that in a minute. It's only in certain counties. It was new to this year. Alright. So this one, again, this is just really to put in your books. So if somebody asks, and you just want to look at the state without having to get into the software, it shows you in which counties, what plan. Pretty darn simple. I don't have to explain any more than that. This one here is your cheat sheet for when you do write the Humana plan. And you know which numbers to put in the application. Because they always have what they call contract numbers. This is your cheat sheet for your contract numbers.
So with the LPPOs, is it only United Healthcare that is non-conventional? with the LPOs?
Put that out of your head, because the reason why they are doing non-commissional right now is you're not gonna write somebody an LPPO, and because they're taking them out the end of the month, end of the year. That's the reason why they went non-commissionable, just the LPPO. You can write any RPPOs, which is what you're gonna write anyway. The LPPOs are only in a couple of counties, but they are gone. They are gone here shortly.
Okay, so but you can write an RPPO on any county.
Yeah.
Okay.
Yeah, it confused a lot of people. I got
Yeah.
clarification, my fault, just to make sure. But it's because the LPPOs are going out. They don't want somebody to get into the LPPO that are automatically going to lose benefits in 2 months.
Yeah.
So, this is the last thing I'll give you on Humana. But again, it's a cheat sheet for what I already gave you. Those 2 sheets. Two sheets. This is a cheat sheet for the benefits I showed you and some of the extra benefits. The over-the-counter, silver sneakers, wine, well-dined. So there's 2 sheets. Telemedicine, all that kind of stuff. It explains what they are. Take one, it's 2 sheets. Pass it over there. You're gonna need one.
I got a question.
2 sheets.
Thank you.
2 sheets. 2
I
sheets.
got a question.
I heard you, Oscar.
Okay, 'cause you said they're getting rid of the local PPO. And,
No,
my mother's
just
under
both of 'em.
Humana.
Jason,
in,
both.
Orangeburg County.
2 sheets.
So what is she gonna have to go to?
2 sheets.
Regional?
There you go. All right, we'll talk about that when we get to United Healthcare. Hold up there. He didn't mean to take you down that little road, but he did.
He said his mom gonna win.
Humana's not doing anything.
Humana's
No.
not going anywhere.
Humana's,
Humana's not changing
yeah,
anything.
they're not changing, it's United.
United's pulling their LPPO.
It's United that's.
Yeah, don't
Not
get,
Humana.
get,
She's
don't
doing-
change companies yet, please.
It's not Humana.
Did you get one of them?
I need the one that says well done.
I
It's
give-
supposed to be 2
Yeah.
sheets.
Well done.
You got 2 sheets.
Well done.
I didn't mean to give you 2 sheets. That confused way too much.
Over the counter and
Yeah. That's really a cheat
Yeah,
sheet.
it says-
All the things that say extras on the bottom, that's really a cheat sheet what these extras are. I promise we're almost done handing stuff out. Trust me, it's a lot of fun to make all these up too.
They didn't even let you get in the system yet?
That's our version.
At the end of the day, it takes just as long to tell somebody how to do it,
Yeah.
because I've already got the templates now. The first year I made these about 5 years ago, it took a long time. And then I got done, I sent them to April and said, can you make this look better? Because it doesn't look very pretty. No. What? Okay. I'm behind one sheet here. I forgot to hand these out. So we're going to stop at Medicare Advantage for a second because this is our Medicare supplement cheat sheet. This is only one sheet. This is very helpful. This will let you.
Did you get that email? Oh, there's something.
No, no love. Just one sheet. These are Medicare supplements. It's a lot easier to spell language.
What did he say? It was a lot easier until he didn't.
3 years coming down.
Oh,
Is that like?
thank you.
I'm not gonna spend too much time on there. It's pretty self-explanation here, but these are not every single Medicare supplement we have, but people ask a lot of times, what are our most popular Medicare supplements? The ones I like the most, I love Cigna. Cigna's come out with a new plan starting here in October 14th. So I went ahead and put them on there. It's going on Cigna paper now instead of just American Retirement Life. AARP's on there, Mutual of Omaha. I write a lot of Manhattan Life and Transamerica Premier. You got some other ones, GCU, Americo. What I like on here is to show exactly who has all the plans. Like AARP doesn't have a Plan G. So you wouldn't want to write a Plan G with the AARP. It won't work for you. You also can see which ones are electronic which ones, what the ratings are, when to write them. Some of them are good for diabetes, some aren't. Like America is a direct bill. I don't like my clients to have direct bill very often, but if you run across somebody that says, I only want direct bill, there's a good something for you to write. Also, it's got some extras, like in America right now. They're doing a $50 commission bonus and a $100 commission bonus. $100 for electronic plan G and $50 for electronic plan F. So if you do an e-app with them, you're going to get an extra bonus, which is kind of nice. Yeah, America right now. If you look on CSI, Central States, it's a Berkshire Hathaway company, Warren Buffett. Some of your clients, if they're pretty well off, they like Warren Buffett. So again, it gives you kind of who to write what, and the discounts are very important. Those are confusing as heck. If you look at these discounts, GCU says they'll give you a 7% if they have 2 people in the house that are 30 years or older. America says they'll give you 10%, but you got to be married, or you got to live with somebody that's over 60 years old, and you live together for a year. But some of them, like Mutual of Omaha, says your partner and yourself have to apply together. So again, there's different discounts for different reasons. So once you realize what your household situation is like that you're sitting with, you can see where you can get the cheapest one, because Medicare right now, they're doing a 12% household discount for somebody over 18 in their house. That's huge. That's huge. Transamerica, I've been on there, it's a big competitive pricing, but it's tough underwriting. They're into the letter of the law. They're not going to let anything slide. Cigna, on the other hand, will simplify the issue. They accept more medical conditions, are very competitive. They'll just charge the price a little more. You can get somebody that had a heart attack in the last year with Cigna, but they're going to cost a little more. Again, back to what's the best thing for you. So, again, that's for just your books. Sorry I didn't go over it before, that's my bad. It got stuck down. But you'll find that very helpful. If you sit somebody and you're looking at what comes up cheapest, and you need to make sure they're going to be able to get approved. Because it's all well and good to have the cheapest one, but if they're not going to get approved with the cheapest one, then you haven't done a very good service for your client. Alright. Well, I got 2 more sheets left, that's it. Now, the last one's not really a big one anyway. Here's the one that you guys are going to want most. This is United Healthcare.
Scott, did it say anything about the AARP, the apps? How to do them in the book? Like United Healthcare's?
Oh, hold on. There you go. Hold on. I'm going to show you how to do them electronically because it's so much easier to do. That's great. I've been using their electronic app all year. Love it. Their electronic app. Any of you guys use the Lean app?
Is AARP going to be in the lead now?
Yeah, we got you.
Oh, okay.
Oh, got you.
I had it on my phone.
Oh, the Lean app is, it's the best. It literally takes you, once you've done a couple, it takes you 5 minutes. 5 minutes in the Lean app, it's done electronically. Oh, that's a $100 fine. Alright, it was actually, when I worked for my father's company 20 years ago, if you were, we were sales guys at the time, but if your cell phone went off during a sales meeting, it was a $100 fine. And you were paying up that day. You always made sure your cell phone was turned off. Alright, United Healthcare. The good thing is, the very first 4 plans have all been virtually untouched. So if you guys wrote United Healthcare last year, your United Healthcare Gold RPPO, which is your plan that you put somebody in if they're a diabetic special needs plan, or if they have congestive heart failure, or any kind of circulation issue. That's your special needs plan. That's the Gold plan. The Gold plan has really not changed much at all. Went down $3 on premium. It was $19 last year. It's $16 this year. Last year, if you were on extra help, your extra help did not do anything to your premium. This year, if you're on extra help, I don't have the exact prices in front of me. You can get them on their website when it comes up. But you're paying less than $1 a month. for the gold plan extra help, which is great. So save people a lot of money. The gold plan, everything else stayed almost identical as last year.
Silver still zero pay-in, right?
Yes. Now, I had to put on there, I didn't put all the other things on there, but if you look on there, silver, it says $8.80 paid by Medicaid. According to their books, that's what they have to say, is they have to show the premiums. If you ever look at a silver book,
Right.
you're always gonna see the premiums.
Talk to you about that.
Yes, yes, but it's paid by Medicaid. They have to by law do that. The reason why is they don't want to refile it with CMS. In order to change that and go to zeros, they have to refile it. In order to refile the plan, you've got to take a plan out of circulation. If you do that, CMS may not allow the plan to go back in. So they would rather not do that. They would rather have the agents explain to people, these are paid by Medicaid. Now, that was explained to me straight through the higher-ups of United Healthcare. It also shows that in out-of-pocket of $6,700 paid by Medicaid. But in reality, for you guys, if you look at inpatient care, PCP, things like that, I put $0, but it's actually $0 or your Medicaid copayment. So they're allowed by law to get a Medicaid copayment. So if they go to the doctor and it charges them $320, they're allowed to. A lot of doctors don't. A lot of doctors will just take it to zero, take what they get from let it go. But silver did not change very much. The only thing different is on their extras. Their over-the-counter for silver is now $100 over-the-counter per quarter.
Nice.
Yeah, they have diabetes monitoring supplies for no cost at all. Their dual plan this year. They do have over-the-counter on the dual plans.
So good.
They did not have over-the-counter last year on the dual plan. That was something they added. People got switched from the dual to the silver just so they can get over-the-counter. I got it right then. I did get that straight from them. When I type things in, I don't always know. I don't read it until later.
I saw the book.
So yeah, I did get that off of the benefit book. I have their benefit books here. I didn't have Humana's yet. Nothing really changed too much in the dual. The RPPO came down $3 on premium. It was $39 last year. It's $36 this year. Again, for extra help, they have some Part D on there, so their premiums would come down if they're on extra help or premium assistance, which is great. The new ones are the AARPs. So the AARP HMO, the first one should say Charleston. Sorry, I didn't say Charleston. The first one's Charleston. The second one's Orangeburg / Beaufort. Everything's the same except for the premium. But I want to put Columbia in there, Lexington, Richland, or as they point out, Richland. No, I think it's Lexington, Richland in theirs. So I wanted to put that in there, so I was running out of room. Because I also want to put the AARP HMO, which again is only in the HMO counties, the zero premium VA plan.
So that one's for the veterans.
That one's the veterans only in the
Richland.
only in those counties of Charleston, Orangeburg, Beaufort, Lexington, Richland. That's correct. Anything brand new with the AARP is going to be in those counties only. Orangeburg was the one that was interesting to me. The Charleston one you gotta understand is only Charleston, Berkeley,
Dorchester?
not Dorchester.
No?
No, I think it's just Charleston and Berkeley.
Dorchester and College.
It's not Dorchester.
So
No, that's Humana.
That's Humana.
That's Humana.
Do we get a map for United Healthcare?
No, there's not a map for United Healthcare.
So,
You know everything, yes, say that again, man.
so
But the biggest thing is Dorchester is not included in the AARP HMO here locally. And the whole reason is they get enough doctors on a certain specialty to be able to get approved by CMS. They will have Dorchester next year.
Scott.
All right, say that one more time.
Yep.
Okay. Which plan was that? That was over
The
here?
AARP HMO, $26 HMO.
Okay.
That is only in Charleston and Berkeley counties down here.
Gotcha.
and it's so,
Other states? Well, you have to look up the states once we get them open. But we don't have, this is just this state. I mean, it's reciprocal pretty close to Georgia. But once you go to North Carolina and the states, they're not in every single state.
So isn't there over-the-counter for the MA only, ARP only? Is there any over-the-counter benefit?
No.
Those are lowest.
No, there's only over-the-counter benefit is silver and dual. The ARP, one big thing difference, it is an HMO, it is a nice price HMO, as you can see on there, it's a little cheaper to get a doctor, it's a $10 PCP, mostly it's a $45 specialist, so it's a little bit cheaper than the HMO if you're comparing next to Humana, it's $5 difference. It is a little bit less of your max amount of pocket, it's only $5,900, so again, a little bit richer benefits, because it's got the ARP branded name. It's only $295 a day, which is the Humana was $360 a day. So it's a little bit cheaper going, going that way. It does have dental and vision on every one of their plans. So the ARP plans are going to have some dental and vision, unlike the other, the Humana, which had some and some of them didn't. It also is going to have silver sneakers. So if you're trying to compare it, somebody was in the Humana HMO before just because of silver sneakers. Now the ARP plan will also have the silver sneakers, which is really pretty big. Does have a nurse line, home health care nurse. It does have the tier 1 and tier 2 generics where you get mail order. It's zero copay. It does have the hearing aids in there, which is different from the United Healthcare versus the Humana. That's a pretty good deal. If anybody needs hearing aids, that's a pretty darn good deal. Exactly. Exactly. You gotta go through HI Health Innovations, but if you do that, $330 to $380 for a hearing aid. It's pretty darn cheap. So it is very nice. Everything else. Oh, the deductibles on the drugs is only $210 deductible versus the $400 on Humana. So again, almost half the deductible.
So
On the gold plan is only $160.
It just seems like there's really no point in even, I know you have to have Humana to offer it as something to your clients, but you even have a VA one here. It just seems like it's...
Just between you and I and the tape, I think that we will write more United Healthcare this year than Humana, just because it is more a statewide offering option. There.
Is there any reason that someone would want to go with the Humana special needs plan other than United Healthcare Dual?
The Humana Special Needs Dual is a little bit of a confusing one too, because it is an HMO, whereas the United Healthcare is a PPO. So it really comes back to the Humana name. Humana has a very good name. I like Humana. I've heard a lot of Humana products over the last 3-4 years, and there's still a lot of my clients that love Humana, and that's great. You need to be able to have that because there are people that like that. You want to give both options. You're not really here to tell somebody how to choose, but at the end of the day, I actually have not done the dual special needs plan from Humana, because when you do compare that, it is an HMO versus a PPO. You do look richer benefits on United Healthcare. So,
Humana is not even accepted here at MUSC, correct?
and going back to the network, so I'm glad you brought that back up. Right now, in accordance to what Humana says too, Humana is not accepted at MUSC. From what they said, the RPPO product, they have heard it being accepted at time and time basis, but you cannot tell your clients to accept it. No, Humana is not in the network at all. As of the other day, Tenet, which is Tenet, not Trident, Tenet Healthcare is not in the network yet either, which is East Cooper. So you just need to be aware of that. Beyond that, that's the only issues.
Like, how do we find out which hospital?
You can go to humana.com.
Doctors are also telling their patients that they're not going to take it next year because we've had to change people due to that.
Well, again, going on and checking the network,
Yes.
when you're sitting down with somebody and you're going over Medicare Advantage plans, that's one of the first things you do. You want to look at who's your primary care doctor. Who do you see most often? I usually ask that first and go on and look at it. If it's in the Humana network, I'm like, okay, if it's in the Humana network, we can look at both plans. If it's not, then I start having a conversation. Is that a doctor you've been seeing for a lot of years? Is that a doctor you want to keep? Those conversations have to be to make sure that you're not putting somebody into a plan just because the benefits are slightly better. If their doctors aren't accepted, then it may not be the right plan for them. Because at the end of the day, you're trying to help somebody make decisions on what's best for their health care, but you got to know things such as if your doctor's in network, or they're taking certain prescriptions, you need to look at his prescriptions, make sure they're covered. Only the other, or one way or the other, so yeah. Awesome.
Okay, I understand that, one of the pharmacists, CVS or something like that, Walgreens or something like that, is gonna drop Humana also. Have you heard that yet?
There are, in all the plans, you do have preferred pharmacies. We're getting ready to go over here just a minute of the drug plans, the last thing I'm handing out. Then I'm gonna show you real quick how to enroll, how to do quotes, and then we're pretty much gonna be done. But yes, they do have, like right now, on our drug list here, our drug plans, SilverScript's one I like a lot. I love SilverScript. SilverScript, CVS does their mail order and is also a preferred pharmacy, but they also have Walmart, Sam's, Walgreens. They have some other ones that are preferred pharmacies.
Scott, quick question for you. Why would United Healthcare disenroll someone out of a special needs plan?
I mean, it could be a lot of reasons. If somebody no longer, first of all, whenever you, who all has ridden with United Healthcare before? Okay, so most people have. When you're, okay, lose my mind. It's okay.
Hey, I'll help you find it.
Are you saying it's already gone?
No, I was gonna say I'll help you find it.
When you first enroll somebody into a United Healthcare Special Needs Plan, there's a couple things that happen. Is number one, the first thing they're gonna do is they need to reach out to that doctor to make sure they have a special need. So they're gonna reach out to that doctor, call back into their provider line to provide them the information for their special needs plan, so they can keep that. If they don't get that, they're gonna disenroll them after 60 days. They'll automatically disenroll. So a lot of times they're reaching out now. They just started this process this year. They're actually reaching out to you as an agent.
Right.
And I had one recently that was reaching out to me saying we couldn't get the doctor to verify their special needs. So I went ahead and got the special needs form filled out, sent it to the doctor. He faxed it back to me, and I got it right to them. So sometimes you got to intervene in there, because if not, they're going to kick them out of that plan. They need to go back and rewrite them back in. That's one reason they can get kicked out. Another reason could be non-payment. I had this happen again last month. I've had a lot of things happen last month. But I had a client that I went back over and found out she was not enrolled anymore. And the person on the phone couldn't tell me why she wasn't enrolled. Well, once I went to enroll her, I got a thing electronically that said, hey, look, the reason why we didn't enroll her is she owes money back and she's got to pay at least half of it to get re-enrolled. And somebody had come in a couple years ago, enrolled her, for some reason didn't put her on Social Security or didn't tell her about it. I don't know. I'm sure the client was getting letters. It doesn't mean anything. I have many clients that get letters that ignore them. But they send back the ones that you don't want them to. But yes, that can happen. Non-payment, they will disenroll you. It takes a while for it. Especially if they're like on the gold plan, $19, it's going to take a while to get disenrolled.
Okay, so it's not something that would happen in like a month.
That's usually because they did not verify the special need.
Well, I got it, and they, like you said, they told me that they had until the end of the month to get that verification letter back, or they would disenroll.
That's something as you as an agent,
right.
I go ahead and get that and get them to sign a new one and send it to the doctor.
Right. I talked to the daughter. She said she had already spoken to the doctor the next day and said that the doctor said yes, they did get the form, they just hadn't faxed it in. She said that the doctor said that they would, and then I seen something yesterday said that she was disenrolled, so I'm not sure why.
Doctors didn't do it. That's why I said you got to take it in your hands. Remember I said a little while ago about the Medicare supplement, making sure that you help them close out the old Medicare supplement and give a new one. Same thing here.
Okay.
I mean, even though the daughter said she was talking to the doctor and they were going to do it, that's a lot of things going on in there. I would want to try to handle it myself.
Okay.
There's also a verification line. The doctor can call right in to United Healthcare, so they have that verification line because that's what they get sent to.
Is that what those numbers are at the bottom of that?
No, it's not on the form.
Okay.
It's not on the form, but there is a verification line doctors can call in, just doctors. But I usually, the last one I just went and did, I went and sent him the form.
Gotcha.
And the doctor, it took him about a week, but he sent me back the form signed. So maybe it's sometimes just putting it back in front of them, maybe they're too busy at the time they sent it.
Right.
But, excuse me, I sent it with a letter on it out of my secure fax line saying, please send this back.
But that is something that I can re-enroll them back into, correct?
You can, but you wanna make sure you're not running that same problem.
Right, right.
Because again, you just be like a little hamster spinning his wheel over and over again.
Right, right, okay,
You don't want that happening, yeah.
right, thank you.
Okay. Last thing I'm gonna do is to show you,
This is part D. Yeah.
oh yeah, Part D. I don't usually go over the Part D too much. It's pretty self-explanatory. If you're rolling somebody into a Medicare Advantage and you need Part D plans, these are the ones that we use a lot. If not, what I tell a lot of people, if they run into some situations that it's not one of these plans that's going to fit them, I'll tell them a lot of times go to Medicare.gov and they can help you get into the right Part D plan. But on the Part D plans, you have United Healthcare and Humana, which are very nice plans. Again, there's also SilverScript. Some people are licensed SilverScript, some aren't. I do like SilverScript, but they make you do their own Medicare training too, which for me, it's a lot of training for a drug plan, but yeah, it's for a PDP. But it is a nice plan. It is a zero deductible plan, and it's only $22.50 premium. Yep, it is the #1 plan that if somebody's on extra help or Medicaid and they've got to automatically enroll them, that is the #1 plan to go into.
Right.
So that's got to be, for something.
2550, like that.
Yeah, it's on the sheet there. No, it's $22.50.
I got the Medicare Advantage.
These are awesome. I got so much good stuff. Doesn't matter, but
Well, they published it in Medicare News, 2017, standalone drug.
they also published 3 United Healthcare plans, only 2. Yeah, I don't know. Either way, okay. Alright, everyone here knows how to get to the dashboard for American Senior Benefits, right?
Yes.
Alright, so on your dashboard, when you come in your dashboard, go to my dashboard, you go onto your quoting tools. The CSG actuarial is where you do Medicare Supplement, Medicare Advantage, Simplified Life is all done right there. Alright, I pull one up, just keep it so it's nice and quick. Very easy, you can go ahead and look at your Medicare Advantage plans. Obviously you want to make sure which plans you're looking at. This one's here is the Humana. This is going to be the plan, it's going to go by price, so it's going to be the VA plan first. There's the Gold Plus right now, it's not going to have the plans for next year yet. 2017 plans, they can't put on there until after October 1st, when they get published by Medicare. But I just wanted to show you where you guys can go over here and see the plans. You can also see the plan details. Plan details will show you everything in there that we just went over on your cheat sheets. If you have the cheat sheets, you don't really need that. The Medicare Supplement, this is the one that's more important for y'all to run when you're running out in the field. Hopefully a lot of you all using tablets and things so you have access to this. Makes it much easier and makes it easier to enroll. Unfortunately, the way that's where it's set like that.
Somebody's turning 65 and you enroll them 3 months prior, when is their first premium due?
Normally, it depends on each company. Some companies will let you go ahead and take it out on their effective date. Some will take it out on a separate date that you want to start it. Some want a binder payment. So a binder payment will be that first one. But if they take that first one, you can tell the client, well, the next payment won't be due until 30 days after your coverage starts. Okay. So each one is different. Usually it'll say on the app.
Coverage starts first of the month following their 65th birthday.
Yeah. So what I like, if you guys haven't used this Medicare Supplement, Manhattan Life, I told you, is one of my favorites. It comes with one of the cheapest ones almost every time right now. I do like Manhattan Life. They're quick. It's a great e-app. All the things I put on there, policy fees, discounts, all that stuff's on your cheat sheet. But what I like is if you want to be able to compare, you can pull your own compare quotes. So you pull 2 or 3 different plans that you want to send to somebody or have somebody look at and pick which ones you want to. For about 10 minutes, John.
10 minutes?
Yeah.
Your battery's dying.
Your battery's.
Battery too. All of your electronic applications are right there. So if you do that, it's going to take you right over to the sites that you need. It's also nice because you can look at details, if you need to explain to somebody how the Medicare supplement works, how the zeros are already built into that. And I like the analytics. What is it? The market analytics, you come in here and see what their increase history is, which is very nice. So if you want to compare 2 or 3 supplement companies next to each other, you can come in here and compare them, and you can pull up the analytics and look right next to each other.
How far did they go back?
Depends on the company. A lot of these will have increased history, a lot of them will have past increase. This one's only been in the market 2 years. They don't have anything in the past. So you're seeing, a little bit of history here. Some will have what they increase, what they expect. Like if you look at, let's see, history.
Did I say we're 7 years?
Like right now, Manhattan Life, right now their increased history has been negative 1.7 on this plan. So they actually have not increased, but they're planning on over the next 4 years increasing 2.1%. So it gives you some idea. It also shows you how